when it comes to heart disease, doctor, there are a number of different tests you may get. Let's show a graphic to our viewers and show us exactly what we can do to diagnose our problem. Here they are.
So actually, I would argue the diagnosis of heart disease starts with a good physical and history. So the doctor should talk to the patient, get an idea what their lifestyle's like, what the potential risks of heart disease are in their life, what their family histories are, how active they are. And then if you're suspicious that the person may have heart disease, or you want to screen a person for heart disease, if you will, there are different tests we do. An ECG is also called an EKG. That's actually something that's a little debatable right now, whether it should be part of a general physical exam, because it really isn't as valuable in this day and age with blood tests and other things, but we still kind of do it. It's a quick 6-second evaluation of the electrical activity of your heart. And for people with enlarged hearts or people with previous heart damage, they can pick that up. Stress test is for most people with blocked arteries don't know it in a resting state, but we hook you up to an EKG, we walk you on a treadmill, we get your heart rate up, and we see if we can provoke or bring out evidence of blocked arteries. Echocardiogram, very safe. Ultrasound test looks for size and structure of the heart. In our practice, as I mentioned with the screen before, when we see people whose atrial chambers are a little rounder or a little larger, we start thinking sleep apnea, because that's what you can see on an echocardiogram as the heart changes. And a Holter monitor, for example, is a little beeper-like device you can wear for 24 hours or 48 hours. It looks at your heart rate. Most arrhythmias are not all the time. People can have episodes of tachycardias, fast heart rates. People can have episodes of atrial fibrillation. So the more we have them monitored, the more likely we are to pick up that rhythm versus when they're in a doctor's office for 15, 20 minutes and they may have a normal rhythm. So if people say, you know, I feel my heart racing every once in a while, I feel lightheaded, I get these episodes, I'm short of breath, the monitor can say, well, let's put a monitor on and see if you're having any episodes. And interestingly, when we wear the monitor for 48 hours and then the doctor looks at it, if we see most of the arrhythmias are while you're sleeping, then we'll say, hey, wait a minute, this person could have sleep apnea because it's during those apneic episodes when they're having these arrhythmias. So that's how all these tests kind of correlate, and the suspicious mind would say, wait a minute, let's think this person could be a candidate for a sleep evaluation.